A facial thread lift is a minimally invasive cosmetic procedure aimed at rejuvenating the appearance of the face. During the procedure, specialized threads are strategically inserted beneath the skin to lift and tighten sagging facial tissues. These threads are typically made of biocompatible materials like PDO, polydioxanone, or polylactic acid. The threads provide immediate lifting effects, and over time, they stimulate collagen production. Facial thread lifts are known for their quick recovery time compared to traditional facelift surgery, with minimal bruising and swelling. Results are visible shortly after the procedure and continue to improve over several months. This treatment is suitable for individuals seeking a non-surgical solution to address mild to moderate sagging in the cheeks, jowls, and neck. It offers a more youthful and refreshed appearance without the need for extensive surgery. However, individual results may vary, and complications can occur. In this video, we will discuss the complications from facial thread lift procedure. Stay tuned.
تؤدي إلى الإصابة بأمراض مزمنة مثل أمراض
instability. Most of the cells in our bodies divide.
And it's relentless. The heart beats 100,000 times a day, 40 million times a year, and up to 3 billion times over an average lifespan.
الصداع النصفي هو حالة عصبية
Unfortunate events recently of blindness after dermal filler.
Asthma is a disorder of obstruction to breathing due to inflammation.
Botox aesthetics.
فعلا هالقد عم قوية.
Hello again. Before we discuss the complications of facial thread lift, let us take a look about our face fat compartments. And remember, with aging, sagging is an important factor. Genome is an important factor in aging and sagging, however. The epigenetic, changed by factors such as sunlight and smoking, is even more impacting. Okay, now let us go over the facial thread lift complications one by one.
Bruising. Bruising occurs when small blood vessels near the surface of the skin are damaged during the procedure. This can result in localized discoloration, typically appearing as purplish or reddish marks. Bruising is a normal side effect and usually resolves on its own over a few days to a couple of weeks. Treatment. Applying a cold compress to the bruised area in the first 24 to 48 hours after the procedure can help reduce swelling and bruising. Some over-the-counter topical creams containing arnica or vitamin K may also help alleviate bruising. Swelling. Swelling is another common side effect, and it occurs as a natural response to the trauma caused by the procedure. Swelling is typically most pronounced in the first few days following the thread lift and gradually subsides. Treatment. Elevating your head while sleeping and avoiding activities that increase blood flow to the face, like strenuous exercise, can help reduce swelling. Your doctor may also recommend over-the-counter pain relievers to alleviate discomfort and swelling. Follow post-procedure instructions. Your healthcare provider will provide you with specific post-procedure instructions to minimize bruising and swelling. It's essential to follow these instructions carefully, which may include avoiding certain medications or activities. Time and patience. It's essential to understand that bruising and swelling are temporary side effects that should improve over time. It may take several weeks for the full results of the thread lift to become visible once the initial swelling subsides. Infection is a potential complication of any medical procedure, including facial thread lifts. While these procedures are generally considered safe when performed by a qualified and experienced healthcare provider, there is always a risk of infection. Here's what you should know about infection as a complication of a facial thread lift. Risk factors. Several factors can increase the risk of infection after a facial thread lift, including poor hygiene during the procedure, use of contaminated materials or instruments, a history of skin infections or compromised immune system, failure to follow proper aftercare instructions. Symptoms of infection. If you suspect an infection after a facial thread lift, watch for the following symptoms. Increased redness and warmth at the treatment site. Swelling that worsens instead of improving. Persistent pain or tenderness. Pus or discharge from the thread insertion points. Fever or chills. Treatment. Infections can worsen if left untreated and may require antibiotics or other medical interventions. Prevention. To reduce the risk of infection after a thread lift, follow strict hygiene protocols and post-procedure care instructions carefully, which may include keeping the treated area clean and avoiding activities that could introduce bacteria to the area. Antibiotics, in some cases, especially with a higher risk of infection due to pre-existing conditions or a more extensive procedure. The visibility of thread extrusion can vary depending on several factors. Thread type. Different thread materials and designs can result in varying degrees of visibility. PDO threads, for example, tend to be less visible than PLLA threads due to their thinner and smoother composition. Skill of the practitioner. The experience and skill of the medical professional performing the procedure play a significant role in minimizing thread visibility. An experienced practitioner will ensure that threads are inserted properly and evenly under the skin. Patient skin thickness. The thickness of a patient's skin can affect the visibility of thread extrusion. Thicker skin may make the threads less noticeable. Post-procedure care. Following proper post-procedure care instructions, including avoiding excessive facial movement and massaging, can help minimize the visibility of thread extrusion. Time. Thread extrusion can be more noticeable immediately after the procedure, but may become less visible as swelling and bruising subside. Skin irregularities after a facial thread lift can occur as a side effect of the procedure. In some cases, the threads may cause dimpling or puckering of the skin. This can happen if the threads are not properly placed or if there is too much tension on the threads. It may result in a bumpy or uneven appearance. Facial thread lifts can potentially cause nerve damage due to the insertion of threads under the skin. This damage can lead to numbness, tingling, or weakness in the treated area, especially near the temples and cheeks. Symptoms may be temporary or permanent, and the risk varies based on individual factors and the skill of the practitioner. Patients considering thread lifts should carefully research and choose a qualified and experienced provider to minimize the risk of nerve damage and other complications. Facial thread migration is a potential complication of thread lift procedures where the inserted threads move from their intended positions under the skin. This migration can result in visible irregularities or bunching, causing an uneven appearance. Factors contributing to migration include inadequate anchoring, tissue tension, or patient movement. Facial thread lifts can trigger allergic reactions in some individuals due to the materials used, like polydioxanone, PDO, or polyl-lactic acid, PLLA, threads. Symptoms may include redness, swelling, itching, or hives at the treatment site. Severe allergic reactions are rare but can lead to facial swelling, difficulty breathing, or anaphylaxis and require immediate medical attention. Facial thread lifts can cause pain and discomfort during and after the procedure. Patients may experience sensations like sharp or pulling pain, bruising, swelling, and tenderness at the treatment site. These symptoms typically subside within a few days to a couple of weeks. Facial thread lifts can result in scarring due to small incisions made during the procedure. Scarring severity varies based on practitioner skill and individual factors. Proper wound care and hygiene are essential to prevent infection-related scarring. Some individuals may be prone to hypertrophic or keloid scars. Hair loss is not a common side effect of a facial thread lift. The procedure primarily affects the skin and underlying tissues, not hair follicles. Any hair loss experienced is likely due to factors unrelated to the thread lift itself.
Not done yet. Few more complications to mention. Enjoying the video, please subscribe to our channel.
Thread breakage is a potential complication in a facial thread lift. It can occur due to various factors, including excessive tension, improper placement, or the type of threads used. Facial thread lift procedures involve the insertion of threads beneath the skin to lift and tighten sagging facial tissues. Puckering and dimpling can occur as potential side effects. This occurs when the threads are pulled too tightly or unevenly, causing irregularities in the skin's surface. It can lead to a lumpy or unnatural appearance. Proper technique, experience of the practitioner, and patient selection are crucial to minimize these complications. Facial thread lift granulomas are a rare but possible complication of thread lift procedures. Granulomas are small, localized nodules or bumps that can form under the skin in response to the presence of foreign material, such as the threads used in the lift. These granulomas may develop due to the body's immune response to the threads. Symptoms can include redness, tenderness, and swelling at the site of the granuloma. Treatment options may include anti-inflammatory medications, corticosteroid injections, or, in severe cases, surgical removal of the affected threads.
Thank you for watching. See you in the next video. Bye.